topic, that is off-label drug use. So what do you mean by off-label drug use? So CDSCO is the licensing authority for drugs in India. When CDSCO give license to a drug, the indications of the drug is mentioned, that this drug should be used for this purpose. Alright. Any use of the drug other than that approved condition is off-label drug use. Okay? So that is off the label. Now in label you are given that these are the condition. Outside the label, that is off-label drug use. So use of approved drug in a manner not consistent with the information provided on its approved label is termed as off-label drug use. Now, so in clinical trial we get the data as Angshuman na tor naam ta Angshuman to, as Angshuman has said, we get the data of a drug from clinical trial. Problem comes in case of children, special population, like children, like pregnant women. It is very difficult to conduct trial in children. No parents want to participate in clinical trial. So where can we get the data from? It becomes a problem. In such cases, off-label drug uses are done. Some special population, some special conditions where clinical trial data are not available, but there must be some scientific basis to it. Alright, you just can't take a drug and give it to anyone and everyone. There must be some scientific basis for giving off-label drugs. So, when do we go for off-label drug use? No therapeutic alternatives are present. So, all the indicated drugs have been depleted. Now, you don't have any choice. Then, potential benefits outweighs risk. That is, some theoretical basis must be present, that this will provide some benefit and the risk will be within our control. Okay? Informed patient with serious condition. So, patient is in serious condition and he or she is, the party is being informed that all the therapies that were there has been depleted. Now we are going for this off-label drug use. So example, sildenafil in pulmonary hypertension in children. So what is sildenafil? Phosphodiesterase inhibitor. So it's an aphrodisiac drug. Alright,